Tetanus in calves is a serious and often fatal bacterial disease caused by Clostridium tetani. The infection usually enters the body through contaminated wounds, naval infections, castration sites, ear tagging, or deep puncture injuries. The bacteria release a powerful neurotoxin that directly affects the central nervous system. Clinical signs begin with mild stiffness and difficulty walking. Gradually, the calf develops rigid muscles, erect ears, protrusion of the third eyelid, and a characteristic locked jaw. The animal becomes highly sensitive to light, sound, and touch. As the disease progresses, there is severe muscle rigidity, difficulty swallowing, extended limbs, and recumbency. Diagnosis is mainly based on clinical signs and history of recent wounds or surgical procedures. Treatment requires immediate tetanus antitoxin, high-dose penicillin therapy, muscle relaxants, fluid support, and nursing care in a quiet, dark environment. Proper wound management and regular vaccination are essential for prevention.